Hello everyone, this is Chadi Alraies from SCAI 2023 in Phoenix. I'm really privileged today to be with Dr. Bilal Hussain. He has been presenting multiple studies at SCAI, but we're going to talk about today the outcome of TAVR in patients with lung disease. Dr. Hussain, thanks for being with us.
Yeah, thank you, Dr. Alraies.
Yeah. So you tell us a little bit about the idea, about where it came from, and what's your hypothesis?
So I came up with the idea that because whenever the patients are admitted for TAVR, like chronic pulmonary disease, whether we're talking about the in the restrictive diseases or obstructive diseases, they're very common, like in general population, and especially in TAVR patients too. So there haven't been much data you can say which looked at from the national level to see what is the impact factor, or how does it actually affect the outcomes in TAVR patients.
Right.
So what I did is that I used the National Readmission Database. I compare TAVR patients who have underlying chronic pulmonary disease compared to TAVR patients who don't have chronic pulmonary disease. So I saw how much burden is it putting in the healthcare community, if it is affecting the readmission rates or not. So basically I tried to compare the readmission rates for both of them.
Right.
So I found out that the patients with the chronic pulmonary disease, they have much higher readmission rate. It's as compared to around 15 as compared to 11 for the patients who do not have chronic pulmonary disease.
What's the reason for readmission?
So the most common reason for readmission was hypertensive heart disease with heart failure, and I also saw the second most common was the complete heart block, which kind of makes sense if you're doing a TAVR, if you get damage the conduction pathways. There was one more common cause was the GI hemorrhage, melon and hematemesis, which could be because the TAVR patients are possibly.
But nothing respiratory as a cause for it.
So there was, but it was very low. There was 1.7%, which was the acute COPD exacerbation.
Yeah. Did you look on duration of being on ventilator, or do you have this data available or no?
So I have the data. I haven't specifically looked into the patients who got ventilated or not. I also tried to compare the restrictive and the pulmonary diseases, and apparently the restrictive diseases had higher readmission rates as compared to the obstructive diseases.
Yeah. And then restrictive, can you specify what disease it is, or just as what the
No. So I looked at separately readmission rate, overall restrictive, and separately too. I looked at interstitial fibrosis, I looked at sarcoidosis, I looked at hypersensitivity pneumonitis, and among these obstructive diseases, I looked at COPD, asthma, chronic bronchitis. Yeah. So among the restrictive diseases, the hypersensitivity pneumonitis had the highest rate of readmission, and among the obstructive, it was the bronchiectasis.
Bronchiectasis, okay. Well, well studied. This again give us a more intel about what patients should be careful with in terms of with this. So how do you use this data for future application for this data for patients who's coming for TAVR?
So I feel what we did is that what we found is not just that they have the higher readmission rates, they also have higher mortality rates, they have higher hospitalization charges, length of stay, everything combined. So I feel when today I was presenting, one of the attendings, she came from the she was just discussing a case with me and who had a patient with TAVR and the underlying COPD, so that kind of made the complications. So we cannot really pinpoint whether it's coming from TAVR or whether it's because of the chronic pulmonary disease. Okay. So I feel it needs to be a bit more prospective, in which we're able to tell better whether it's severe AS initially we're doing the TAVR for, what's the severity of the COPD, and try to medically optimize it before we actually do the intervention. So I think that would be
especially now for TAVR, it's not required to do PFTs. We don't know part of the product. You do CT scan, you echo and stuff. We don't do PFT. PFT more the surgeon will look for because it's part of their STS score. But maybe somebody, especially if they have established lung disease, maybe PFT could help navigate some of these nuances.
So I feel it's important to this kind of gives an idea that there is an association. So it needs to be looked more into. We need to optimize that. We need to make some kind of combined you can say management guidelines, screening to see how can we specifically manage these COPD patients, because very common every patient has it.
But maybe it's going to be also helpful because patient population getting younger for TAVR, so if they have established lung disease, they don't want to be coming back for something but that's good information.
Especially in asthma, it's very common in the young people.
Absolutely. Well, Dr. Hussain, thanks so much for sharing this information. Please watch these videos and others on SCAI TV. This is Chadi Alraies from Phoenix. Thank you so much.
Thank you.